Dr. Redlener, I want to begin with where Anthony Fauci just left us, which is the astonishing complexity of this disease. This was really big news to me, the idea that HIV was less complex for him to grapple with than what he's working with now. And that we're at the very beginning of understanding it. What more? Can you expand on that for us?
Yeah, sure. This is, it's always been called a novel virus, meaning that no one's ever been exposed to it before. So we don't really know anything much about the behavior of this virus. And there are many, many issues, as Fauci was saying, that are just coming to light. For example, people have long-term neurologic problems. They have memory issues, executive function issues. There are people who had the disease many weeks ago, but still have not regained and may never regain their sense of taste or smell. And then we have a whole series of pediatric complications that occur long after the child has presumably got the infection, now being called this multi-system inflammatory syndrome in children, which has hospitalized hundreds of children around the country. So this is a learn-as-you-go process, Lawrence. We don't really have anything to compare it to, and we're basically in a wait-and-see game, just as Dr. Fauci was talking about. But we do have a long way to go, and clearly talking about the end of this happening at any time in the near future. We're just, unfortunately, kind of kidding ourselves in a way. What we have now is a lot of chaos about the information, about the data reporting, about how many fatalities are there really, and on and on and on. And what I'm afraid of is this absence of information and this data chaos is creating political opportunism that people will be able to say whatever it is that they want, including whatever it is that Trump is planning to, what his narrative is going to look like in the first week in November.
Speaking of confusion about the data, we have this Harvard analysis, satellite photographs of Wuhan, and noting the traffic in the hospital parking lots and noting a very big surge in the traffic in the parking in the hospital parking lots beginning in August of 2019, where previously we thought the earliest activity there might have been November of 2019.
Yeah.
We've been constantly pushing back in time what we think might be the beginning of this. And now we could be all the way back to August. What does that tell us then about the curve of this pandemic if we really were to begin it in August?
So, Lawrence, this is more confusion, more chaos. We've had trouble from the outset understanding what China was actually saying. Was it accurate? Was it withholding information? What was its relationship with the World Health Organization? And on and on and on. And of course, refusing to allow Western scientists from entering the country. So I say we're operating in a vacuum in terms of when this actually started, how severe it was, and how rapidly it was transmitted. But we sure as heck would have liked to have known, because it would have made a big difference in how rapidly we reacted. We didn't even react obviously that quickly when we did know something was happening on a global scale, and there kept being these constant denials by the president. But that being said, it really is important information that this actually might have started last summer. It's absolutely incredible new information.